My name is Monica Rapicak, and I am a level one student in the Masters of Athletic Training program at North Central College. The podcast today is about the benefits of utilizing an athletic trainer in the tactical athlete setting. Here with me today is a former Indiana Athletic Trainers Association president, Justin Miller. He is an athletic trainer who works with the tactical athlete population at Public Safety Medical located in Indianapolis, Indiana. So today we'll first start off with what interested you in the tactical setting, and how do you advocate for athletic trainers in this setting?
That's a great question. It's kind of a funny story how I got involved. I've obviously been an athletic trainer for about 25 years now. And so this setting, of course, when I started, didn't exist. It's a relatively new setting. And it's actually one that I did not seek out, to be honest with you. My current employer was on the lookout for an athletic trainer that could begin doing some movement assessments as part of annual physicals that would be performed on all first responders. So, as you mentioned, being a public safety medical, it is strictly first responder oriented. So, everything from police officers, firefighters, Task Force One, Homeland Security, you name it. So, they were wanting to get that started. Within Ascension, I was at the time working with our sports performance group that did traditional sports medicine, so outreach at middle schools, high schools. We had strength and conditioning, we had rehabilitation, sports psychology, you name it. They reached out to sports performance to say, hey, who do you have available that would do this and be able to kind of handle the workload of all the data and coming up with a program. And so fortunate for me, in hindsight, they reached out to me and asked, hey, would you at least come in and be an interim athletic trainer until we can find someone to hire? And as I came in and heard more about the program and what the vision was, I said, well, wait a minute, forget interim. Can I just simply apply right now? So I think part of it was a new setting, at least for me, that I had never been a part of, and it was very different from traditional, scholastic athletic training. I was at that time. I was in a physician practice, which was not unheard of, and so I thought the transition to first responder sounded really, really neat. There was a chance to start a brand new program and be a part of that. And it was at this point in my career, being something new to do and kind of being able to call something my own was pretty cool. I had opportunity to be a part of research as well and try to get things published, which I'd never dreamt of that. I'm not a doctoral level trained athletic trainer, and I'm not in the collegiate setting or the research setting, if you will, where that can be done easily. So that's kind of my story in terms of how I got involved with first responder or the tactical athlete program. From an advocacy standpoint, I don't do anything unique about advocating for athletic trainers in this setting any different than any other setting. So I don't, even though I could be biased and say, oh, well, absolutely, this group deserves to have athletic trainers more so than any other, which is, I think we all know is not true. Anyone would benefit from athletic trainers being involved in their active lifestyle. So I will tell you that it may be somewhat unique, at least in my area within Indianapolis. There's quite a bit of activity surrounding first responder healthcare. So if you don't mind me segueing, into a different part within this answer, there are athletic trainers. I'm fairly unique to be where I am. So in kind of what I would predominantly consider a wellness setting. So we're seeing first responders come through and go through an annual physical and be a part of that process. There are also athletic trainers with other vendors, if you will, locally that are fully embedded in police departments, fire departments, and are an athletic trainer for them, just like any other high school, college, or professional team. And so they are there daily evaluating injuries, taking care of them, and rehabilitating injuries. There are athletic trainers that are part of groups that strictly do rehabilitation. but strictly for first responders. So I think this area around Indianapolis is, I think it is, I hope it's not, fairly unique with having that many different types of opportunities for athletic trainers to be involved in specifically just first responders. So for a setting that's relatively new, I think we have quite a variety of opportunities here around Indianapolis. But from an advocacy to really, I guess, just jump on top of that and get that answered for you, it's clear that first responders are physically active. I know that the tactical athlete name is kind of at least within the first responder world, most of them seem to laugh at it and say, I wouldn't call myself an athlete. There are certainly those that fit the stereotype from the general public of thinking, the big, strong, highly active firefighter or police officer. But I think the large majority are just like you and me. They're pretty average people who happen to have a unique interest in what they do and are trained to do things that most of us would never consider even trying. But they certainly deserve the utilization of an athletic trainer. We see it across the athletic world without blinking an eye and go, well, yeah, that makes sense. But here are individuals that do a slew of different activities all day, every day that they're on duty. And, especially from maybe a taxpayer standpoint, because these are publicly funded agencies, we don't think about the fact that, well, gosh, who pays for their health care? Well, we do as taxpayers. So it seems like makes all the sense in the world to have someone like an athletic trainer be involved. And we have said for years how we can save from the financial side, whether it was athletics, in school health care with athletes, but certainly now from a public money standpoint of how much can we save with healthcare costs for those that are injured on the job. And then I think everyone wants to be supportive of first responders. The one thing that gets me the most with working with them is hearing stories as they're getting closer to retirement, what they're not able to do physically, just the wear and tear on their bodies. And so if anything, you go, how can we help? Certainly as athletic trainers, to allow these individuals to get through their career and go into retirement in a physical condition that allows them to enjoy it.
Thank you. So with that, what is your typical day like, and what type of tactical athletes do you usually see?
Sure. So as we've touched upon already, predominantly firefighters. Certainly what we do and what I do specifically carries over to law enforcement without a problem. You'll just find that the attention that fire departments put towards fitness, wellness, whether it's mandatory, optional, or just all the components of that program that they choose to utilize compared to law enforcement is very different. So law enforcement, I think, certainly cares about it, and they care about their officers. There's just not the history in law enforcement from that physical fitness and wellness side as firefighters have. So my typical day varies. It's very, I shouldn't call it seasonal, but it all depends on which departments are choosing to utilize my services. And so you could have a number of departments doing it, but just based on when they have their physicals, there could be some days where it's relatively slow. But when we do have them, actually, better yet, kind of move backward a little bit. We talked about public safety medical, and we do these physicals and all. We don't just do them in-house, like here in the office. So we have a significant portion of our business that is off-site. So we will travel with our medical assistants, our exercise physiologist, nurse practitioner, myself, as a crew with all of our equipment in a van. We'll go to a particular department, sometimes staying a week at a time, if not multiple weeks, to make sure we get everyone taken care of. And so I just came off 3 weeks of working at a local department, so driving home and there every day. But solid for 3 weeks, and each of those days consisted of seeing 12 people a day. And so each rotation is about a half hour, and we'll see them in groups of 4 because we have 4 different rotations. And so, seeing 12 people a day, 60 a week, would be a fairly solid day and week of doing the movement assessment piece of the physical. One additional part of my job, separate from doing movement assessment, is coordinating the process to validate work performance evaluations. So again, this is where fire departments are a little bit more unique than law enforcement. They have something universally performed, I think, nationwide. Not every department does it, but a work performance evaluation is essentially kind of like an obstacle course that contains multiple events that are representative of the essential basic skills that that firefighter or that fire department would face on any given call. So most departments do the same events. They'll tweak them here or there, but so a lot of my days were slow doing movement assessments. I'm doing a lot of work with departments at various stages of this process, and that's everything from sitting down with the department with a committee within the department who is tasked with designing the course, picking out the events, choosing what kind of distances, lengths of hose, weight of hose, weight of equipment, those type of things that they're going to do for each event. And it's my job to help guide them through that decision-making process and make sure that we're kind of dotting the I's, crossing the T's, making sure that they're justifying why they're picking what they're picking, why are they making it as hard as they are, and then really taking them from that whole process to constructing the course, testing the course, having the entire department run through it. And then I work closely with the National Institute for Public Safety Health, which is a standalone research institute that's closely tied to public safety medical, and they will analyze all the data, the times, all the factors, and present a recommended cut time, if you will, for that course. So my days can be split, certainly between that traditional movement assessment piece, but then also working with all these other departments and those various stages of that work performance evaluation validation that they want to go through.
So then if you see errors in the functional movement screen, do you start rehabilitating them or do you send them somewhere else?
Yeah, it's a great question. And I will say, since you made mention of a functional movement screen, which is a very specific tool that can be used for movement assessment, we used to use that. So FMS was used. We currently use a new program that is completely motion capture, using cameras and computer to analyze the movement. But yes, we'll take the results of either of those tools, whatever we find, however we know we can utilize that data, and provide, if the department chooses, provide some feedback along with some exercises, stretches, strengthening that will help address whatever movement issues we find. And so, as you can imagine, the movement assessment piece for the annual physical is very similar to having a blood draw and looking at lab results. You do that annually, and you kind of see where your numbers are and see if maybe a change in your diet, a change in activity level have made those numbers change or not. Same thing with movement. So we'll try to give some things that people can do. Again, it relies on their compliance, to follow through, just like it does with trying to affect lab results. And so you look from one year to the next and hope that those numbers are changing. We know, I guess, very similar to lab results, that movement numbers will change as you get older. So if someone has really poor movement, regardless of age, we should be able to improve those numbers up to a point, and then you'll probably still see those numbers over time start to gradually come back down. So it's one of those things where some people are in a position based on age, previous injuries, previous surgeries, where we can maybe make a little bit of a difference. But sometimes we just try to maintain those numbers instead of saying, hey, instead of hey, let's bump that up by 10%. Let's just try to keep it from going down 10%. And so that's where a lot of people are, is we just try to maintain and prevent things from getting worse. We'd always like them to get better, but yeah, that's certainly the goal. Is in my mind, there's no point in assessing anything if you're not going to act on it. If you just say, "Oh, that's great to have numbers, great to have data, yay," you can do a research paper and publish it. But even research like that, to me, at the end of the day, I hesitate to say worthless, but it's not nearly as valuable um, unless you put some sort of action behind it. And so, yeah, we absolutely will create a relatively small, simple program and let them run with it, and hope that they again are compliant enough to perform it and have that desire to get better.
So do you typically have a lot of firemen and police that do not comply with the rehab? And if so, how do you guys go about that?
Yep. So we've had a wide mix. I've had everything from tremendous feedback and saying this is awesome. I wish we had this years ago. I love the idea behind it, and so many at least are positive and forward thinking with it. That doesn't always mean that they end up being compliant, but they are more likely to be, for sure. Uh, there have also been plenty that speak out right away and say, "Well, this seems stupid." Some of the movements are like, "Well, none of these movements I do as a firefighter or a police officer." Well, no, not those specifically, but you need some sort of combination of these movements throughout. And then when we provide some programming, not many, but I've had just a handful who may at least took the time to email me back, but would make the comment, "Well, none of those exercises or activities you gave me have anything to do with firefighting or being a police officer. That's a specific activity." And again, it's uh, maybe more of an excuse than anything, because I think we all know that they all work out to some degree. They do their bench presses, they do the squats or lunges, whatever. None of those are specific, right, to their job. And so there's always resistance to any program, no matter what you do. And I'm sure the nurse practitioners uh, would have the same type of stories when it comes to, hey, look at these lab results, look at these numbers, you need to do A, B, and C. Some of them just whatever. Some try, or we all do, like, hey, we need to floss more, to brush your teeth more. Um, Maybe we do for the first few weeks after that visit, with the provider, and then it dies down some. It's very hard to do anything about it. Obviously, you have your annual follow-ups, and assuming numbers haven't changed or they've gotten worse, you have that same discussion. Ultimately, it's up to them, right? And it's also up to the department. The department has a vested interest in the health and well-being of their first responders. Certainly, the healthier they are, the less likely they are to have something go wrong from a health standpoint while they're on duty. Um, and so, depending on the department's view, their culture, and what they prioritize within the department, that makes a huge difference. Like that, 3 weeks that I just came off of, um, that department has a huge priority on physical fitness and wellness. And so almost 100% of everyone who came through, whether they were good movers or not, understood what we were doing, liked the idea, were happy that we were doing it. Again, doesn't mean any of them will be compliant, but there's at least a positive vibe with everyone. Other departments, you can tell when they come in, there might be an eye roll, or there might be like "Oh, really? We're adding this?" And there's just kind of either a neutral or an apathy towards it. And then I think that just relates to potentially either the culture of the department, or just how effective leadership is in trickling down the belief system, and emphasizing the importance of these type of things that we do annually, outside of just saying, "Hey, by the way, physicals are coming up in a month, just have give you a heads up." What do they do the other 10, 11 months out of the year? Do they mention anything about fitness and wellness? If they don't, and it's just, hey, when it comes around physicals, you're going to have people that probably aren't going to stay on top of it. But if you have departments that every month or every couple of weeks are throwing out communication to some degree, addressing fitness and wellness, you're much more likely to realize, holy cow, this is important. Or if I don't keep this up, I'm probably not going to be able to work at this department very long, and we'll have to move on. And so I think from what do you do about it, it's more about the culture of the department. And then we can help affect that just by every year addressing, here are the issues that your department has, and here's what will happen if you don't address them. Um, all we can do is, like any athletic trainer, is educate, try to help prevent. And as long as you keep doing that and you do it in a consistent way, I think your chances certainly go up. But it ultimately comes down to the individual. Again, making sure they have all the resources, the information they need to make good choices, and then their employer, in this case, the departments, to make sure they trickle down that same belief.
And then in the traditional sports setting, the athletic trainer is in charge of returning the patient back to play. How does it work with returning the firefighters or law enforcement back to their occupation?
Yeah, that's a good question. So at least the departments that work with us, most of them will utilize us for what they call fit for duty. So, and that can be anything from physical or mental. So if it's a behavioral health issue, if it's a physical issue, either way, it's a fit for duty. And then our physicians have a process in which they will evaluate um, very in depth to make sure things are clear and ready to go. Um, I alluded to the work performance evaluation earlier. That's kind of like doing a functional progression within sports. So if you're an athletic trainer and you take an athlete through a functional progression, there are a lot of um, you know basic movements that you'll take almost any athlete through, and then at the end you get into the very sport specific things that are a little bit more challenging and more specific to the actual movements that that athlete will do in sport. So having said that, whether I'm involved in the process or not, if they are cleared through the fit for duty process through us, they were typically released back to their department. And not every time, it certainly depends on what the issue was, but many times they will be required to pass that work performance evaluation, go through that obstacle course within that, whatever the department's cut time is, and pass that before they can go back on duty. So it's very similar to traditional athletics. I've been involved with some fit for duties where someone comes back after a surgery, they've done rehabilitation. So you have, maybe the surgeon, who performed the surgery, who is basically signed off, hey, you're good, to do whatever. They've done rehabilitation, and so their physical therapist, athletic trainer, occupational therapist, whoever worked with them, is most likely signed off as well. And obviously, whatever physician, typically the surgeon who's overseeing them, they've all done kind of their sign off. Then they come to us, and so really we don't necessarily test and poke and prod as much as make sure we have all the documentation, we have all the different clearances that are appropriate. We do all of our questions and all of our work. Maybe I do another movement assessment to compare it to a baseline that we've done as part of those annual physicals and say, hey, how close are you to what your normal movement is? But we take all those factors into play, and then, like I said, sometimes they'll go through the work performance evaluation or functional progression, and they're back. And then even when they get back to the department, the department has kind of that ultimate say of, well, how much do we put you back in? Do we put you full right away, or do we modify some things? And again, to relate that to athletics, how many times does an athletic trainer say, hey, you're good to go? You give them back to the team, but the coach still has them on some modified activities. They don't throw them in 100% yet. So I think it's all that same analogy. They're almost identical to the traditional sports model.
I know you touched on the mental health aspect. Do you see a lot of that in the setting?
Yeah, it's we see it. And again, I'm not on that side as much, but I certainly hear through meetings that we have on a consistent basis. Quite a few. Typically, we see it more on the law enforcement side than fire, and those are for different reasons. It could be occupational reasons. Certainly, maybe just the type of people that are drawn to each profession are a little bit different. But on both sides, it's a significant. I don't want to say issue, but we do see quite a few. It's from what I've seen recently with different associations like the Indiana Association of Fire Chiefs, and I think the police side, law enforcement side as well, that behavioral health is becoming much more critical, but also much more accepted. There's always been that stigma or that taboo, like, oh, we don't talk about mental health because it's a touchy subject, or if someone has a mental health issue, we automatically think, oh gosh, they're crazy, or something's really wrong with them. The fact of the matter is probably 90+%, probably even more, a significant number have some sort of mental health issue, not all of which are clinical or need to be put through any sort of treatment. But I think everyone has some form of it, even those people that aren't in first responders world. So we do see it quite a bit. We have a team of psychologists that are within public safety medical. Our main job from that side of it is to assess everyone and help identify people that might be at risk or already in a position where, hey, we need to get you to a professional for some follow-up and get treatment. So we don't do any treatment here as much as we do everything we can to screen, so screening applicants. So we see a lot of applicants come through for different agencies where they'll use our physical process, our behavioral health checks, and kind of help weed out, if you will, people that wouldn't be a good fit for being a first responder. But yeah, it's quite prevalent, and it's something I think that over time it's just going to become more and more mainstream, which is, I think, the big goal now is to make it something where the first responder becomes more and more comfortable with the process each year of being asked certain questions, answering certain questions, and knowing there are really no repercussions for saying something, that like, well, I'm not going to say yes to that. It'll be interesting over time to see how many people start opening up and how those answers change, and how many more people we can get to and help prevent some more significant issues.
I'm not sure if you mentioned this yet, but do you provide any injury prevention programs? If so, what type?
Yeah, so going back to the movement assessment piece, we'll send programs that typically have basic flexibility, muscle activation, very basic. We don't have just kind of cookie cutter injury prevention programs. What we try to do is with departments, if they've gone through our program with me, is we can analyze the data. We can take a look at what areas of the body seem to be the most prevalent with issues, movement issues, whether it's super tight here or I can't, keep a certain shoulder aligned real well. If we find that across the department there's an overwhelming 2, 3, 4 of those items, we could probably come up with certain programming that we put together and say, listen, if the majority of your department are having these issues, let's put up this program on the wall of every workout room within the firehouse or the police station, so people can reference those and say, okay, I can do those. And that's all in addition to each person potentially, if the department has chosen to do it, is getting their own personal program based on the movement assessment. And so that would be the best one to go off of. Certainly if they got the personal one. Now, if they've chosen not to do that, but we still have all the data for the department, I think that's where, hey, we didn't give everyone a personal program, but we can certainly give you a kind of a department-wide, here are some red flag issues that are 60, 70, 80% prevalent within your department. Just start with this and have everyone, who's interested, try doing these handful of stretches or exercises and see if we can't at least address a decent percentage of the issues we're seeing across the board. But yeah, to wrap that answer up, there's not just a flat injury prevention program other than taking the different pieces of what we offer and then kind of tailoring that to whatever the department chooses.
So with the police departments and fire departments, do you see most of them coming through with workers' compensation, or can they come by themselves with their own insurance or self-pay?
So our practice, like I said, is fairly unique. It's one of the only ones around that really does what we do from a medical standpoint. There are practices that do strictly rehabilitation, and they'll see just the work comp. Um, I can't speak to all of that vendor's policies and who they see and how they see them, but I know that they exist. And so, from our perspective, what we see is when people come through, it is strictly on the dime, if you will, of the department. So, if someone's coming through for their annual physical, that particular city, town, municipality is paying for that service. So, no one pays out of pocket to us for anything. If there's something we refer them to based on a finding, and we say, "Oh, you ought to get A, B, and C done," a lot of that can be out of pocket for them. Okay. And then from a rehab standpoint, workers' comp, we do not do rehab here. So we do not see really workers' comp at all from that perspective. The only time we would is, again, if they're coming off of all of that and they're going through that fit for duty process where they're getting cleared to come out of that. I guess technically you can consider that workers' comp or a workers' comp individual who's in that process. But no, nothing done here that's out of pocket. And so typically we don't see, workers' comp, but it's all paid for, if you will, by the departments.
What are some of the challenges you face working in this setting, and how do you overcome them?
Good question. Not as many now. Certainly when I started, I think there's the obstacle of not knowing your audience as well. So, when you're an athletic trainer and you're going through college or you're going through your program, you typically get pretty well exposed to different sports, what an athlete's like. You kind of get that feedback. Most people that are going through athletic training have likely been an athlete themselves. So they kind of understand it. They know the culture. Coming into the first responder world, again, you come in with not necessarily misconceptions, but some preconceived ideas of the mentality, just kind of their attitude. What are they going to be like? It didn't take very long for me just going through what I do and luckily having the time to sit down and talk. A lot of times on a personal level with many of the first responders, and you find that they're just like anybody else for the most part. So it's an initial obstacle, but like I said, just through the course of doing your job, you learn that pretty quick. And I think for this position specifically, because it was brand new, it's really like having a new position anywhere else. You kind of have to define what's our goal, what are we doing, how are we going to do it. I can't tell you how many different times when I came up with different spreadsheets or different forms of how am I going to collect the data, how am I going to present it, what type of questions do I want to ask. Like it changed, every other week. And even now, a few years into this, we're still tweaking some things and we're changing a process here or there. And so I think the biggest thing, luckily for me, having been an athletic trainer for 25 years, none of it, at least as of now, none of it flusters me at all. If anything is challenging, you go, okay, have I ever seen something like this before? Or it becomes less even reliant on experience as an athletic trainer as much as just kind of experience in general with anything and everything that you can think of. Is how do I attack this? And then the other is working with in such a team atmosphere is realizing, like, if you're used to being at a high school and being the athletic trainer, you might be the only person there, or it might just be two of you or three of you if you're at a really large high school. And here we have 40 plus people all over the place doing different things, and uh, knowing when to communicate, how to communicate, being open, to feedback and ideas from other people. Because you might think, well, I'm the only athletic trainer here doing this. Nobody else, has a clue. But then all of a sudden, you get some feedback from somebody else that you wouldn't have thought of. And you need to be open and say, well, how can I take that? And maybe I only take 70% of what they said, but it has a place. And so it's not to shut off, being open to criticism, feedback, those type of things, I think is critical. And that's how I've been able to address minor roadblocks, or you feel like you've stalled somewhere, and like, we need to get further than this. We need to get beyond it. And it's just, I think the biggest comes down to communication. Um, how do you do it? Who do you listen to? And again, when it comes from someone who you would least expect, uh, there's almost always something that you can pull out of that, even if it's 5% of everything they said has a place. And then ultimately, being thankful for the people that are around you and that are trying to offer help, even if they give you absolutely nothing that can be used, is, again, thanking them for that, and then keeping all those connections open. Because who knows, when you really need them down the road, or vice versa. You want them to always feel welcome to come back to you and ask for feedback on what they're doing.
So lastly, do you have any tips for any athletic trainers that want to pursue this career?
Uh, in this particular setting, or
Yes.
the career? Yeah. So in this particular setting, I don't have a whole lot, other than everything that you had to listen to in your own mind to even be interested in athletic training. Uh, Continue to listen to that and be open to it. Because, like in my case, for being an athletic trainer over 20 years, uh, and never really have heard of the first responder world, or how an athletic trainer can fit in real well, or not thinking there's a position available. I didn't pursue it, but it kind of fell in my lap, and it was something I said, "Oh, this is pretty cool. Why not? I'll go with it." Um, the hard part about somebody coming into a profession, any profession, is that you don't know what you don't know, right? So you can come in and think, oh, I want to be an athletic trainer. I want to work at college. That happened. So many of my classmates going through undergrad was, I want to work college. I want to work college. I want to work college. I think a lot of that is because that's what you are currently in. The majority of your time is around college athletics. We watch college athletics on TV uh, as much, if not more, than the professional teams on TV. And so that was a desire. Um, and probably, out of 14 in my class, maybe two ever did college athletics. And so everyone else goes somewhere else. And unfortunately, you get a lot of people that drop out of the profession. I think this is a little bit of a tangent. I think that the good news about people like yourself that are going through a master's program is that if you've chosen to go through undergrad and now said, I'm going to go to a master's degree on top of that, that length of time, the odds of someone sticking around in that profession go way up. It's easy to do a 4-year undergrad, think, I think I like this, and then you just drop out. If you've done 4 years and then you're going to do another 2 on top of that, the expense and the time that you take, I think, helps that. The problem is you're still going to come out, um, even if you get exposure to, let's say, me, and you came in and I was a preceptor, and you get a little bit of exposure, that helps. And I think that's the key, is if you're in a program, take advantage certainly of every opportunity that's given to you. You're always going to come through rotation where you're not interested, but that's kind of the point, is to figure out what interests you and what doesn't. It's not that, hey, you should enjoy every single rotation that you take. Uh, it's probably better that you don't, because then that starts to fine tune what you really want to do. So I would just say, be open minded, because you never know when something's going to pop up, or you're going to go through a rotation that you whatever, and you show up and like, holy cow, this is pretty cool. Because it's very similar to, again, what happened with me is I was just doing a lot of traditional things and things that were readily available. Um, I can tell you for a fact that when I got the call and said, "Hey, this is what we're interested in having you do, at least come in for a little while," I did not feel good about doing it at all because it just that didn't seem to interest me. But then when I came into the office, listened to the doctor talk about his vision, he'd been doing this for over 30 years, and getting the idea, all of a sudden I walked out just after that one meeting and said, "This is what I'm going to do, hopefully for the remainder of my career." So, and that's coming after 20 some years of doing other things. To still be able to find something that got me excited and is I would pass that along to all of the students coming in is relax. If you've gone as far as becoming a master's student, going through a program, you clearly want to do it. Uh, don't get discouraged if you haven't found that one area that really interests you the most. Certainly do it, get involved, meet people, network. That's what opens up doors to so many people. And sometimes it takes you 20 some years before you find exactly what really interests you the most.
Thank you so much for your time and your help, as well as the opportunity for me to ask questions. Um, if there's any other questions you want to ask me, please feel free.
Boy, yeah, I can't think of any right off. I certainly thank you for inviting me to do this. It's exciting to be able to share kind of that story that I just told you about. Hey, what can happen over the course of going through school and the next 25 years after, how things change. And um, I think I did the same thing going through school, and you hear your mentors and those people that have been in the profession for so long, and to think that I'm now being able to do that same thing to people like yourself and give you some sort of advice or feedback as to how it worked for me, and if that helps anybody, um, that's pretty awesome. And so, thank you for asking.